Welcome to this mini lecture on leisure, drugs, and health. Over the next 10 minutes, there are two main objectives that I'm going to try to get through. The first will be to review the sometimes complex relationship between leisure, drugs, and health. And second will be to talk about some of the social and policy issues related to the drug-health relationship. Specifically, we'll review regulation, normalization, and harm reduction, and we'll also talk about a case study of drug tourism along the way. Below, you'll find links to two videos that I think are a good starting point to watch before watching this lecture. The first one talks about the war on drugs and some of the kind of broader social policy issues that shape the way we think about drugs. And the second one is about addiction. So while it's much more kind of focused at the individual level, it also challenges us to think a little bit differently about the way that we treat drugs in our societies. In approaching this lesson or this lecture, it's a good idea to think about how we can approach this with an open mind and have some kind of critical, open-minded discussions about the role of drugs in the context of leisure and the implications that that has for our health. So when we talk about drugs or substance use, this is really fundamentally a social issue. So we can define drugs as basically any substance that has any sort of physiological effect on our body. That means things from herbs that we use in natural remedies to caffeine that's in the soft drinks, coffee, and tea that we drink, over-the-counter medicines that we may take for a headache or some kind of aches and pains or upset stomach, things like workout supplements that enhance our recovery or improve our performance in sports or the gym, and then also the more illicit substances that we think about when we say drugs. Any of these things that have these physiological effects are considered to be drugs. The difference is the way that we treat them in our social and political systems. So these drugs, broadly defined, serve many purposes. Some of them are strictly related to medicine or how we can fix or improve our body. Drugs also serve social and cultural purposes. And the different purposes that we use drugs for also change over time. So it's important to consider that our kind of social and political understanding of drugs and what's acceptable and unacceptable and how different drugs are used do change over time, and that is something that we need to consider and think about. So if we reflect back to a time when alcohol was prohibited, so we called this prohibition, that looks very different than what it does today when alcohol is kind of widely accepted and consumed by a variety of different people. So these processes of using drugs and the impacts that drugs have are highly implicated in social change. In approaching this conversation, it's also important to consider how we're defining health. So, as we've seen before, health is not simply the absence of disease, but there's many dimensions to include, including social, emotional, and spiritual dimensions that all contribute to our overall well-being. So while some drugs, like medications, are explicitly associated with health, others, like illicit substances, are often uncritically assumed to be negative. But this is really a function of how we're told to think about these things rather than based on any sort of hard evidence. So some over-the-counter drugs or some prescription drugs may have a more intense or a more negative physiological effect on our body, but the way we use them has us trained to think about them differently. So it's important to have this kind of open-minded discussion about drugs is moving beyond the stigmatization of illicit drug use and consider the way that different substances do have impacts on our bodies and how they can be used in social ways as well. So essentially, it's not drugs themselves that are inherently bad, it's the way we treat them, police them, and stigmatize them that can lead to negative outcomes. And this is really hit home in those videos that you can watch linked in the description. And now leisure. leisure is an important context to consider the implications of drugs and health and the diverse different ways that drugs can influence our health. So, I will assume that most of us have probably used substances to enhance our leisure experiences in one way or another. Some of us may enjoy having a drink at the pub or over dinner with our family and friends. Others may enjoy smoking a joint while reading a book or listening to music. And yet others may enjoy taking ketamine and dancing at a rave all night. In all of these instances, drugs are used as a way to enhance the leisure experience and to realize a different kind of outcomes from these leisure experiences. So, drugs are an interesting thing to consider through a leisure lens. And one of the really interesting things that we see is the changing relationship between drugs and health based on different things like regulation. So in Canada, very recently, we have seen the legalization of recreational marijuana. And since then, there has been a real explosion of byproducts which have purported relationships to wellness. So we see CBD products everywhere that claim to have these health promoting benefits or to enhance wellness in various different ways. So, with that one simple shift in policy, we saw a huge change in the way we're looking at CBD and treating these products. So now I quickly want to take us through a case study and talk a little bit about the use of drugs while traveling or during tourism. So traveling allows people to have a variety of different experiences and to visit different places. And I think we generally would accept that these are used as ways to relax, enjoy ourselves, enhance our well-being by taking a break, regenerating, getting away from the stresses of our regular lives. So in some kind of foundational tourism research, Cohen did a study where he looked at these different modes of tourist experiences. So, looking at the tourist experiences and what they really meant for people. And he categorized these experiences into 5 different categories. The first was recreational, so people who engage in tourist activities purely for entertainment, just to be entertained, to have fun. The second was diversionary, so looking at getting away from those everyday stresses and pursuing pleasurable experiences. So having some hedonistic or pleasurable purpose to the activities that we do. And now with these first 2 categories, what's important is that people engaged in these modes of tourist experiences are not really necessarily unhappy with their day-to-day routine or their regular lives. They're not seeking new meaning with that. That's just the essence of the experience. So seeking fun or entertainment or pursuing a more deep kind of pleasure, but not being dissatisfied with their day-to-day life. In the final 3 modes, these people are seeking a different kind of meaning through their tourism or travel experiences. So the experiential mode involves a quest for an authentic experience. So looking for an authentic cultural activity somewhere else that you could consume or be a part of. But in the experiential mode, there's no desire to adopt any part of that practice. The experimental mode constitutes someone who wants to try these authentic experiences and pursue some new meaning that they can integrate into their life. So consider a friend who goes on a trip, learns some yoga practices, and then brings that back and integrates that into their regular routine. And then finally, we have the existential mode. And this is someone who is already committed to a way of life or a cultural center that is geographically or culturally external to their own. So someone who already identifies and practices with those other meanings, but that is different from where they're actually from. So they're seeking that out on their tourist experience. So now to bring this in relation to drugs, there are lots of different ways that this is involved. So traveling provides us with the opportunity to visit places where regulation and cultural practices associated with different substances may be different from what they are in one's home place of residence. So an example of this, marijuana cafes in the Netherlands for a long time have drawn tourists from all over Europe and all over the world who were seeking out a place where they could consume marijuana and hash in places where it's socially sanctioned. More recently, we've seen the emergence of music festivals as sites of these kind of um, acceptable transgressions where drug use is assumed and it is common, but not necessarily um, endorsed by the organizers. So, what these other researchers did was looked at people's experiences in using substances while they're traveling or touring. So, they called this drug tourism. And so, considering these different modes of tourist experiences, they found that they applied to this drug use as well. So, while some people were simply engaged in pleasure oriented pursuits, so um, trying drugs or using drugs for fun, these people were typically people who would use drugs during their regular routine, but they were also using them to enhance their fun while they were traveling. But then a third of the people who were using drugs while traveling actually associated this with some sort of meaningful experience that they had. So for some people, this was experiencing authentic aspects of local cultures. So things like smoking opium while searching for that kind of authentic Bedouin experience. Others were looking to find meaning in subcultures associated with drug use specifically. So things like 420 and cannabis culture that are associated with their own kind of sets of practices. And then others were seeking out these more alternative subcultures which had drug use associated to them. So think an underground rave scene that has a very kind of clear resistance idea around it, but the subculture itself is not centered around drugs. Drugs are just a part of that. So what's interesting is considering the way that these different experiences have implications for health and health promotion. So considering that health is not just simply an absence of disease, we can think about the ways that our more social, emotional, and spiritual health are implicated. And these people discuss the ways that the experiences of using substances while traveling help them find meaningful experiences, help them feel relaxed or diverted from the stress of their regular lives, building experiences and connections within these different cultural groups, and feeling accomplished and satisfied with learning the different aspects of these different cultures and engaging with different people while they traveled. Okay, so now knowing what we know about these experiences and the ways they can be implicated in health, I want to shift gears to some of the more social and political aspects of substances and drugs. So when we talk about these drugs, different places will have different processes in place for regulation. Essentially, regulation is the way through which particular substances are controlled, monitored, or prohibited in different places. And involves a range of different things. So from food inspection agencies at the federal level, which monitor the quality of food and pharmaceutical products that come in and out of a country or region, right down to more local level things that we might see. So at the national level, we have these things like national level regulations and quality control on food and substances. At the regional level, we have things like policies which monitor legal age for consumption or alcohol sales, or which medical drugs are covered under provincial healthcare plans. And at the local level, we have things like liquor licensing, which determines where liquor can be sold and consumed. We have bylaw enforcement, who polices or allows different types of consumption in different spaces. And we have rules on space, like parks and public spaces, and what drugs are allowed to be consumed in different places. So there's a range of kind of levels of policy that influence the way drugs are taken up and used in different places. Another important thing to consider is the way in which drugs or substances are treated on the kind of social level. So the normalization thesis is essentially a theory that drug use is becoming relatively normalized, particularly by youth, and we need to change the way we think and talk about drugs in order to reflect this. So the trouble with this is it's different to measure what normalization looks like, and as such, it's really hard to measure. But what these researchers have theorized is that normalization is marked by ease of access, so how easy it is to get drugs, higher use in general of certain drugs, as well as a tolerance by people who aren't users of the drugs. And this can be seen in different ways, including cultural accommodation, so the way that these drugs are portrayed or seen in things like the media, as well as changes in policy and the way that we regulate these drugs at a more social level. So, the big picture, this involves a change in thinking about drugs from a criminal or pathological thing and acknowledging that drugs should be studied as a normal behavior so that we can look at it and look at the different things that influence the use of substances or drugs. But this is challenging and really not easy because different groups of people in any society or social group will have different views and perspectives and understandings of what that drug is or what that drug means and whether or not it is actually normal. However, the important thing is to shift that thinking away from all drug use as criminal or pathological and to have some room for these open discussions. Another really important thing that we're seeing more and more of now is this idea of harm reduction. So, harm reduction is essentially a public health approach to drug use. So, seeking to minimize the negative outcomes of a phenomena without actually eliminating the phenomena itself. So, recognizing that drug use will happen, and rather than penalizing everyone who engages in it, trying to figure out the ways that we can support people to minimize their risks in their use. So some of the things we see, the common kind of harm reduction campaigns that are out there are needle exchange programs where people can exchange needles for clean ones to ensure that you're using clean equipment, as well as things like drug testing practices where you can take the drugs which you intend on consuming and having them tested to make sure they are safe or make sure they are what you expect them to be before taking them. And there's examples of these harm reduction initiatives in both of those videos linked in the description below. Unfortunately, harm reduction is often construed as a political tool and used either funded or not funded by different governments or organizations. And this really makes it difficult to use and measure and evaluate these initiatives when there isn't consistent support for them and evaluation of them. So all of these things have a few trends that we can talk about. First is the need to treat recreational drug use as a reality that we need to work with or discuss as a reality, as opposed to working against and trying to prevent entirely. While both normalization and harm reduction are gaining significant attention in health policy, they can't be essentialized into one thing or the other, and they need to be critically examined for both the pros and cons. And both of these things, or all of these things, really challenge some of the ideological principles behind the war on drugs, or the idea that we need to eradicate drug use completely, and suggest that we need to think more critically about the pros and cons of drug use and their regulation, and what they mean for both individual and community health. So in summary, the relationship between drugs and health is a complex and kind of multifaceted phenomenon. It's something that we need to approach with an open mind and a willingness to have kind of difficult discussions that take us outside of our comfort zone. Leisure offers a really interesting perspective to view drug use from, as it helps us kind of acknowledge some of the both positive and negative potential outcomes that can come from drugs, as well as the way that we regulate them. And importantly, all experiences with drugs are framed within these social and cultural processes in which the experiences happen. So having open and frank discussions about normalization and different policy implications are an important way forward to better understand the outcomes of drugs for individuals and society more broadly.